Hey guys, my name's Elicia. I'm a business coach for massage therapists, and we empower therapists and give them clarity to be able to run amazing businesses. What I want to share with you today is how to set goals so that you actually achieve them. One of the most important things in any business is having a clear vision of where you're actually going. And often what can happen is we get so overwhelmed by the great big, I think I want to do this, but I look at where I am right now and go, heck, I don't even know where to start. One of the strategies that you can use to actually break this down is to have a look, well, where do I want to be in 12 months? And if I had a look at it and said, if I was there in 12 months, what would it look like? What would it sound like? What would it feel like to be in that place? And get really, really clear on that vision. Now, often we can kind of go, I just want to be happy, or I want to be making more money. And my invitation to you is to imagine that somebody is standing next to you and they have to be able to see the goal as well. So make it really, really tangible. For example, if I said to you, meet me in the middle of the Sydney Harbour Bridge at 12 o'clock on Sunday and I'll give you $1 million, could you get there? Well, the answer is, of course you could, because you know exactly where it is, you know when it is, you know what it'll look like, and the reward you get for getting there. We want our goals to be just as clear. One of the ways that we do this with our clients is we look at where do they want to go over the next 12 months, then we break it down, well, what do they need to focus on each quarter to get there? And then we break it down to what is it they need to focus on this month in order to achieve the goals for that quarter. And then we break it down as what is it they need to do this week in order to be able to connect themselves to the goal and the results they want in their goal in 12 months' time. Although it sounds super easy, this strategy is, while it is very easy and very simple, it's an amazingly powerful tool to help you be able to know, how do I actually start? What is my first step in order to be able to get me on my goal of where I want to go over the next 12 months? Have the courage to set your goals. Set them so in a way that actually inspires you to want to get up out of bed and go, yes, I'm going to connect with that, and then break it down into bite-sized chunks, quarterly, monthly, and then weekly, so that you know the exact steps that you need to do this week to grow your business and turn your passion into a rocking business.
Hey folks, today we've got Bruce Stark from ortho-bionomy, who'll be talking to us a little bit about his journey and where he is moving to in the future. So welcome, Bruce.
Thanks, Dave.
Do you want to firstly just talk about a little bit about your background?
Well, it's quite a varied background.
Yeah.
My original training was as a classical musician and also studying German, and of course, leaving university, they're very profitable skills to have, not. So I ended up doing a lot of different things. But one of the things that I ended up starting to do was to study ortho-bionomy. And in addition to the other medical school teaching I was doing and criminal justice research I was doing, this was the thing that seemed to get my imagination the most.
Okay, and in what way? How is it different?
Well, for me, I was dealing with stress, low back pain, neck shoulder issues, and was referred to this person who did ortho-bionomy. I was wanting to get body work, but I had no idea exactly what ortho-bionomy was.
And is this in Australia?
This would have been back in the States, so this is about over 30 years ago now.
Wow, okay. So ortho-bionomy's got a fair history in itself as a treatment?
Yes. It's been around since the mid-70s, and it was developed by a British osteopath. And the focus of what he wanted to do was to find ways to gently and non-invasively affect changes through the body without using force. And so he started in his osteopathic training to take the principles of positional release techniques, which were relatively new back then, and at least in the osteopathic world, and to refine them and to look at how to speed up the release times, but also how to address different types of issues besides just bony structural alignment issues.
Okay. So do you think, because it is a gentler style of technique, that it sort of appeases or ticks a lot of boxes for massage therapists and remedial therapists? as far as training?
I think so, very much so. I think that one of the things that ortho-bionomy training does, is really develop your sensitivity to be able to feel different types of tissues, different types of responses in the body, and also to have tools and skills to be able to interact with those different, what you notice, to be able to affect change in a non-forceful, non-painful way, actually.
And the first part of the training, and I remember seeing this for the first time, phase 4, so not phase 1.
Not phase 1.
But did you want to maybe just talk about the different training levels that go into the ortho-bionomy system, I guess you could say?
Yeah, definitely. Yes, it's always been a question. Why do we always start with phase 4? And partly because it's a carryover from the founder's research project, which was starting with the strain, counter-strain, positional release work, which he considered phase 1. And so he went through a couple of other phases of development, and we got to the level of phase 4. Phase 4 is using positional release, but also tracking different types of responses through the body, so that when we do positional releases, we're able to sense responses through the tissues, also be able to notice how that information is being integrated through the body. Then there's phase 5. So phase 5 was something which is more looking at more the movement dynamics that are present. One of the things that the developer, his name is Arthur Lincoln Pauls, so Dr. Pauls was looking at was finding how to facilitate a change and activate the self-correcting, what he called the self-correcting reflexes within the body. And what he identified was that there were specific sorts of responses in the tissues to track. And so phase 5 is looking at those different kinds of responses, which actually indicate functional patterns, use patterns, distortion patterns through the body, and then gives us some skills to be able to address and balance those. So phase 5 does that.
So as a practitioner, you become more sensitive and aware of the responses of the body.
Yeah.
That's what you're looking at in some ways?
Yes. And for me, it's one of the things that it's about is being able to create a communication mechanism or communication vehicle between practitioner and client. And I think that the tools and the skills of ortho-bionomy do that. And then in phase 5, it becomes even more energetic, actually looking at energetic applications of it. So we go from everything from purely structural work through to the energetic perspectives, or relational perspectives, as I would call it as well, that can be drawn from throughout the session to be able to tailor the work to what's specifically going on for people.
And from a treatment, excuse me, I do have a cold. From a treatment point of view, someone comes to see you because you were just saying that you're fully booked at the moment as well as all this teaching.
It's good.
But a typical treatment, is that sort of a 40-minute or an hour, or how long is a normal treatment?
Yeah, so a normal treatment session, I have hour sessions, so the amount of treatment time in that is probably about 40 to 45 minutes of actual treatment work. And generally what I'm looking at is focusing on the area or areas that people are presenting with. It may involve whole body sort of interaction, but often people are coming with low back pain or knee issues or neck pain or frozen shoulder or something like that. And so we're going to be spending most of the time focusing on the issues related to those particular areas.
So you talked about very briefly some different areas of the body that are fantastic for treatment with ortho-bionomy. Do you want to give a couple of examples of some conditions that might be good for treatment?
Well, certainly anything related to joints, anything to joint issues, that's something we can certainly work with. But common pain issues, including disc issues through the spine. We also look at supporting different types of autoimmune sorts of issues. So things like rheumatoid arthritis, we can be really effective in working without overstimulating the system. Fibromyalgia, chronic fatigue, those sorts of things can be particularly beneficial. We can work with structural distortions, so spinal distortions like kyphosis, scoliosis, those postural distortions that are happening through the body. And people are wanting to address pain issues that are resultant from those sorts of postural distortions. I do a lot of work in rehabilitation, so people rehabilitating from injuries or rehabilitating from surgeries as well. So it may be in conjunction with some of the physiotherapy work that they're doing to in a way have some time to get more in-depth work into what's going on for them to complement the other things that they're doing. Other things that we work with would be immune system dynamics related to neurolymphatic imbalances.
Okay.
So we have that particular perspective. Can work with quite a lot of things.
Yeah, absolutely, for sure.
Which makes it quite interesting, actually, because I have no idea what's going to be showing up from what people are presenting. So in a day, I can be working from doing something like working with an ankle injury or ankle sprain that someone's had, to working with trauma dynamics that are through the tissues, so hypervigilance, hypersensitivity through the system, that then it could work through the nervous system to balance that, to working with immune system issues, to working with postural re-education, and it keeps it quite fascinating.
Yeah. Now, the term ortho-bionomy is probably not overly well known in the general public, right? So basically, what do you hang on your shingle? I mean, how do you, and plus your students who then go on to obviously use the treatments, what sort of, how do you address the public as far as who you are and what you do?
Right. Well, first, just the term orthobionomy itself was developed by Dr. Paul specifically because he thought that it represented what his work was, what he was trying to put together. So ortho coming from correct or straight, as in orthodontia or orthopedics.
Sure.
Bio, like in biology, meaning life, and onomy or nomy is a suffix that means the study of or the laws of. So the definition of the term orthobionomy is the corrective application of the natural laws of life. That's basically how he would describe that. And the natural laws is from his osteopathic training, that the body has a self-corrective component to itself. And that what we're wanting to do is find ways to activate that or to stimulate or support that, so that the client is actually experiencing more of their self-corrective process through the session. What I put on my shingle, I put orthobionomy on my shingle, and the thing that I find is that when it's actually a fantastic way to start a conversation about what to do.
Sort of an inquisitive mind to think what is orthobionomy.
Absolutely,
so,
absolutely. The very first question is, what is orthobionomy?
Sure.
And so then I talk about the structural work or addressing pain issues without causing pain, or the gentleness of it or the non-invasiveness of it, and that's what gets people interested in pursuing that.
Okay, fantastic. And for anyone out there who's interested in doing a course, do they have to go through a series of these courses to be able to apply what they learn, or can they start treating at the end of their phase 4?
In fact, all of the courses go through a huge range of all of the aspects of the work. And what's also really, I think, quite beneficial is that even after a 2-day course of phase 4, you can take that information, those skills, and apply them straight away.
Great.
And start incorporating them in the work that you're already doing. I know some people who have taken one particular course and said, "No, this is what I'm going to be doing," and basically tried to just straight away changed everything from that point on.
Okay.
But usually most people are wanting to integrate that in, of course, in what they're already doing, which is actually quite good, because orthobionomy is a great standalone modality, really quite a powerful standalone modality, and also blends really well with a lot of different things. You would even think that perhaps that it wouldn't blend with something like deep tissue therapy, trigger point therapy.
Is he going from
like
light
that,
to heavy work?
Right. But in fact, it's actually quite complementary, because an example might be using a position around the trigger point that you'll be working with, and then that already starts a release process there, so that the work that you would do as a therapist is actually easier, and it's actually more tolerable for the client as well. So you can start to integrate it in a lot of different ways straight away.
Fantastic. For those who are interested in courses, now you teach here in Australia, but also overseas as well.
Yep, I teach in New Zealand, teach some in the States. I have taught some in Germany in the past. It's been a while. But
Yeah.
It's been a while.
Okay, well, this is going out to Connect, the association Connect Broadcast Show on Facebook. So do you want to let the viewers know, this is going out, we're pre-recording this little segment, but we're going out at the end of May or sometime in June. So have you got some dates lined up post sort of May onwards?
Certainly do, yes. And on my website, which is brucestark.com.au.
Okay.
And on my website, I have a listing of all the courses that I teach. And I know straight away, I think in June, I'm teaching in Sydney a 4-day anatomy and physiology course with an ortho-bionomy perspective, which is open to actually anyone who's a body worker, because of the type of work, the type of information that we talk about there is like why what we do works is what my focus is. So that's happening straight away. And I am teaching phase 4 course in Sydney, I believe is in August, I think it is. It's coming up then. And I have to look at my site. I haven't looked at it lately.
You need to go to Bruce's website.
That would be the best thing to do.
The other thing that you can do also underneath this little segment is an area on Facebook where you can actually post messages. So I'm sure that Bruce will be viewing this when it comes out. So make sure that you can ask Bruce questions via the post as well. Yeah,
be very happy to answer any questions anyone has, any information that they'd like to get.
Fantastic. Is there anything else you want to say before we sign off, Bruce, at all?
Well, actually, what I'd like to say is with my relationship with Massage and Myotherapy Australia over the years.
This wasn't a planted question, by the way, but okay, fantastic. Go for your life.
I have always found that this has been a great group of professionals, a great group of people as far as working to create the organization, but also bringing people together in the conferences, which regularly been a part of, either presenting or as a exhibitor as well. I think it's been a really high-level professional organization that is doing a lot of good things for the bodywork field.
So it's good to be a part of it. And you've been a part of it too through our conferencing year after year as well. So yeah, fantastic. All right. Many thanks, Bruce.
Right, thank you very
much. And you guys, hope you enjoyed the interview. And stay tuned for our next interview in our next Connect. Thanks.
The client should be facing away from you. The draping should cover the client from the shoulders to at least the knees. Ask the client if they would like their feet covered. Place a pillow under the client's head. Place a pillow under the bent knee or between the knees. Lay another towel on top of the existing draping, in line with the client's armpit and covering the torso. The client's top arm can then be placed outside the draping. Hold the top towel firmly in place, whilst slowly pulling the underneath draping out and downward until the top edge is visible. Grasp the top corner edges of the draping and fold it back over itself to lie along the line of the top of the hip. Ensure the client is covered both front and back. The client may like a pillow to cuddle. Tuck the draping between the table and the hip. You may need to ask the client to roll forward slightly to do this. Tuck the draping into the waistband of the undergarment at the client's hip. Pull the draping and the undergarment downward and toward the midline to uncover the upper gluteals only. On completion, return the draping to lie across the top of the hip if you are going to massage the back. Otherwise, re-drape to cover the torso and shoulders.
How do I change associations? Making the decision to change associations can be a difficult choice. Some questions you might ask yourself: are my current associations' values the same as mine? Do I get what I need for my business and career? If the answer is no, then maybe it's time to join Massage and Myotherapy Australia. You can find a list of qualifications the association recognises on massagemyotherapy.com.au/join-now. To join, download an application form via the Massage and Myotherapy Australia website. Include in your application a list of your current active provider numbers. There may be a slight disruption when your previous association cancels numbers. If this occurs, contact us as soon as possible. If you include evidence of your current association membership, Massage and Myotherapy Australia may provide you with a discount. Don't hesitate. Join Massage and Myotherapy Australia, the Association of Professional Therapists.
Hello guys, Jeff Shearer from Ethical Practice and Evolve Natural Medicine, here today for Massage and Myotherapy Australia to give you a tip on how to create a successful and sustainable practice. So the first thing that we need to consider when we're building our practice, we're starting out, maybe we're starting again, we're re-evaluating, we need to stop and actually go back to, well, what is it that I actually want? What am I trying to achieve? Do I want to create a practice where I'm fully booked every week, 6 days a week? Do I want to create a practice where I've got multiple practitioners working for me? Do I want to have a multi-modality practice? It's really important to start with the end in mind. That way, you're able to make sure that every step that you take is in sync with your values, in sync with your vision. So this needs to be not just a mechanical idea, but something that is in sync with who you are and what you want to bring to the world. Thanks very much, and look forward to speaking with you next time for our series for the Massage and Myotherapy Association.